Good afternoon. Thank you, my chairpersons and the organization and everyone on the board for having me, and welcome back after a long vacation for COVID-19. I wish health for all of you. I will skip the physiology that you all know about the cerebral flow and cerebral perfusion, pressure, vascular resistance, and intracranial pressure. And I will talk about the collaterals. Collaterals are the life savers, life preservers against hyperperfusion. The most efficient of the collaterals are the circular foils, subarachnoid collaterals. And they are the determinants of the outcome after disturbance of the cerebral blood flow. There are cortical collaterals, leptomeningeal collaterals, and the dural collaterals between the intracranial and extracranial carotid arteries. The most common etiology of hypoperfusion or cerebrovascular insufficiency in adults is the atherosclerosis. But AVM can produce hypoperfusion by steal phenomenon, which may be overlooked sometimes, especially the arteriovenous fistula that do not appear in the cross-sectional images, the CT and the MRI. If you perform cross-sectional image for a patient suspected to have hypoperfusion, you may overlook arteriovenous fistula, and he may suffer or she may suffer from hypoperfusion. In pediatrics, they have congenital or developmental diseases like moya-moya disease and arteriovenous malformation also. The most common or the nearest diagnosis to our brain is a stroke and transient ischemic attacks that happen due to hypoperfusion or cerebrovascular insufficiency. And most of our treatment is directed to treat or prevent stroke or TIA. But we have vascular dementia, we have impairment in cognitive function even in children, and we have affective disorders as depression. In adults, there is bad collaterals if it is a small vessel disease. It may affect the outcome. Consider my colleagues and my professors that in papers that we publish our previous work. But in conference, it is an opportunity to discuss current and future research and to explore these areas. There is bad collaterals in atherosclerosis if it is a small vessel disease, but you may find a good collaterals if it is a large vessel disease like carotid stenosis. Common indications for intervention in cases of hypoperfusion, TIA, ischemic stroke, less attractive and the possible important indications that are the cognitive decline, the adult onset seizures, and the personality changes. In this paper, they found that cerebral hypoperfusion is suggested to be a cause of white matter attenuation. The dogma of age-related evolutionary changes may find correctable causes of hypoperfusion. In adult onset seizures, late onset epilepsy and occult cerebrovascular disease, similar results. In children, the moya-moya disease is the nearest diagnosis to our brain, and remember that if you do not know it, you will not find it. In the last month, we operated 2 cases in a Hussein hospital, and met another case, which was a child, 7-year-old, Sudanese, treated for years as multiple sclerosis due to white matter dots in his cross-sectional images, the MRI, but he had moya-moya disease. So it's a rare disease, but at present we face cases of moya-moya disease, but you will not diagnose these cases except if you perform vascular investigation, not only cross-sectional investigation. The common indications for intervention in moya-moya disease are also repeated stroke and TIA. This attractive and possible important presentation include mental retardation, school failure, and seizures. You may face a child with school failure. This may be the only presentation of moya-moya disease. Moya-moya disease means the supraclinoid stenosis, the intracranial stenosis associated with the leptomeningeal collaterals without any other disease. but it's a syndrome if it is associated with atherosclerosis, neurofibromatosis, the other diseases. The arteriovenous malformation is an important cause of hypoperfusion in the adjacent brain due to steal phenomenon. Also here, they found that the posterior cerebral artery feeders for the cerebral AVM was significantly associated with structural epilepsy. So even in children, epilepsy may be due to hypoperfusion. How will you examine hypoperfusion? By perfusion studies. Maybe the superior perfusion study is the MRI perfusion with the well-known parameters, measured parameters, the cerebral blood flow, the mean transit time, cerebral blood volume. The duplex examination of the carotid artery provides an indirect information about hypoperfusion. And the catheter angiography SPECT may provide value in detection of hypoperfusion. And this is a study about the chronic fatigue syndrome, and they found an evidence of hypoperfusion. The notorious research area is the possibility of intervention in these cases and the value of intervention in these cases. Hypoperfusion in autism spectrum, cerebral hypoperfusion occurs in many areas in the brain in patients diagnosed with autism spectrum disorders. The cerebral reperfusion includes medical measures like vasodilators and the subarachnoid hemorrhage, the nemodipine, thrombolysis and acute stroke treatment by the tissue plasminogen activator. The surgical intervention include the occlusion of the stealing fistula. This is a method of reperfusion, and it may happen reperfusion injury in the adjacent area of the arteriovenous malformation, and this warrants sometimes staged embolization of the AVM to avoid the reperfusion injury. So occlusion of the AVM by endovascular methods or surgical extubation, a method of reperfusion. And revascularization, like thrombectomy, acute stroke, angioplasty stenting, carotid endarterectomy, direct anastomosis, and indirect synangiosis. We operated many cases of carotid stenosis by angioplasty stenting. We explored the cognitive function, and we found among 43 patients, 22 who had mild cognitive impairment. 17 of them have improved after revascularization, which means that 2/3 of patients with cognitive impairment due to hypoperfusion may benefit from revascularization. In Moyamoya disease, we operated cases, not many cases, but we found even by synangiosis and the restoration of flow here of middle cerebral artery, the immediate improvement of the deficit. This patient had the aphasia improved because it's a living brain. The child is aphasic due to hypoperfusion. Cerebral insufficiency causes are atherosclerosis, Moyamoya disease, and AVM. Symptoms, the nearest to our brain are ischemic stroke and the TIA, but we have adult onset seizures, affective disorders, impairment in cognitive function. And the reperfusion procedures include carotid stenting, carotid endarterectomy, arterial anastomosis, indirect bypass, and occlusion of the fistula in AVM. This is a summary for the presentation. Choosing the suitable patients for these techniques, the nurturing environment, as we mentioned, for research. Thank you.